Signs and symptoms of gout and management of gout. First, we will see about signs and symptoms. Gout has classic presentation of acute, sudden and severe pain in first MTP joint, that is big toe. MTP means metatarsal phalangeal joint. Usually come without warning. During the attack, the joint or area becomes hot, red, swollen and extremely tender. Most common joint involved is MTP. Other sites are ankle, midfoot, knee, elbow and wrist. Clinical features of pain. Rapid and acute onset, reaching maximum severity within 2 to 6 hours. Pain usually awakens the patient in the early morning. Patient often describes it as worst pain ever. Pain feels like volcano fires. Extreme tenderness such that patient is unable to touch feet on the ground or anywhere. He can't wear his socks on. Marked swelling with overlying red and shiny skin. Self-limiting pain. Takes 10 to 14 days in complete resolution. Apart from severe pain, patient may have mild fever, malaise and confusion. Acute or chronic. Gout may be either acute gout or chronic gout. Because of increasing level of uric acid, acute attack of severe pain is known as acute gout. And in chronic gout, chronic inflammation of one or more joints because of increasing deposition of uric acid crystals known as tophi. Tophi. Tophi may be deposited in joints and in soft tissues. Common places of deposition of tophi are extensor surfaces of fingers, hands, forearms, elbows, Achilles tendons, and sometimes the helix of the ear. Tophi are white in color. It can ulcerate, discharging white gritty material, become infected or induce a local inflammatory response with erythema or pus in the absence of secondary infection. How to diagnose? Lab investigations include aspiration of fluid from the joint space. Aspirate will show crystals of uric acid under microscope, bursa or tophi. In acute attack, fluid shows increased turbidity due to high neutrophils. In chronic gout, fluid may be white due to high crystal load. Blood test to measure high level of uric acids. Biochemical screen, which include renal function test, lipid profile, and uric acid to know any metabolic syndrome. Elevated ESR, CRP, and neutrophilia in acute gout. Radiographs are usually normal in acute gout, but well-demarcated erosions in patients with chronic gout or tophaceous gout may be seen. X-ray, ultrasound, and MRI are useful to see the soft tissue swelling and any destruction if there is. Management of gout. Aim of management is to relieve pain during gout attack and maintaining uric acid level below 6 mg per dl by giving urate lowering drugs. NSAIDs are simple pain reliever, usually prescribed to relieve pain during acute attack of gout. Local ice packs are also suggested to relieve pain. For recurrent episodes, colchicine is effective, but it has some side effects such as nausea, vomiting, and diarrhea. Joint aspiration and intra-articular injection of steroids followed by Early mobilization are very effective in acute attacks of gout. Uric lowering therapy for patients who have high level of uric acid crystals with recurrent attacks of gout. Allopurinol is a xanthine oxidase inhibitor. The starting dose should be 100 mg per day and in older patients 50 mg per day. The dose of allopurinol should be increased by 100 mg every 4 weeks and 50 mg in elderly and those with renal impairment. Febuxostate is a xanthine oxidase inhibitor which is useful in patients who fail to respond with allopurinol. Because of hepatic metabolism of this drug, no need to adjust the dose in patients with renal problems. It is more effective than allopurinol and starting dose is 80 mg per day. Pagloticase. It is a biological treatment which is indicated for the treatment of tophaceous gout resistant to standard therapy and is administered as intravenous infusion every 2 weeks for up to 6 months. Side effects are infusion reactions, which can be treated by antihistamines and steroids, and flares of gout during the first 3 months. Annual monitoring of uric acid is recommended to prevent the attack of gout and to adjust the dose of uric lowering drug. Avoidance of triggering factors. In addition to drug treatment, predisposing or triggering factors should be avoided, such as drink plenty of water to remove uric acids from the body. Diet with high purine content should be avoided, such as meats, seafood, vegetables like spinach, mushroom, asparagus, cauliflowers, oatmeal, dried beans, lentils should be taken in limited amount. Alcoholic beverages should be avoided. Add low-fat dairy products in your diet. Follow healthy lifestyle and diet plan and exercise. Watch my video about health tips. For more updates on healthy lifestyle and medical problems, visit www.askmeforadvice.com. Thank you for watching. Do not forget to like and subscribe.